for extremity patterns, okay, D1 and D2. The D stands for diagonal. And people have now the group in the, I don't know if it's CAPD or APTA or whatever, they would like it if instead of saying D1, you said flexion, adduction, external rotation. Okay. Which, to my way of thinking, is absolutely stupid. You can say something in one word, why say it in four? Okay. So, probably on the licensing exam, quite possibly, they're going to refer to the diagonals as flexion, adduction, external rotation. Or they might call it D1. I'm not sure what they do.
So they're still doing D1 and D2. I checked with a couple of people. So do know what's a D1, do know what's a D2. It's never a bad idea to know the other terminology as well. It's just in case.
But if you know what D1 is, you can say it in words, that's all. Okay. So, so with the extremity patterns, the proximal segment and the distal segment are linked together. Okay, which means they always do the same thing together. Okay, the intermediate segment, which is either the elbow or the knee, can do whatever the therapist thinks is appropriate to do. So in D1, diagonal 1 is basically hand towards mouth. That's the direction. But D1 is shoulder flexion, adduction, and external rotation. So you can think of it as the direction of hand to mouth. You can think of it as doing a right uppercut if you're into...
Or you can hold your ear in the...
Or you can pull your own ear, okay? But whatever goes up and across, okay? Flexion, adduction, external rotation. The most natural way to do that is with the elbow flexing. But don't even write that down yet, okay? What happens is the wrist and hand, the wrist goes into radial flexion, okay? Flexion, wrist flexion with radial deviation, and the finger flexes. Fingers flex. When the fingers flex, the thumb is outside. It's not a cortical thing. Okay, here, look at this. So D1 flexion is flexion, adduction, external rotation, wrist flexion with radial deviation, finger flexion. Okay. So those two, the shoulder and the wrist, are linked. They always go together. The elbow can do anything that the therapist wants it to do. The elbow can flex as you're doing the motion, okay? The elbow can start out in flexion and extend as you're doing the motion. The elbow can start in extension and stay in extension as you're doing the motion. There are patterns that are most logical and most natural, which is elbow start going from extension to flexion. Okay, that's the most natural. But the elbow can start flexed and stay flexed, can start extended and stay extended, can start flexed and go into extension, or can start in extension and go, well, if we do that, okay. So it can do anything that the therapist wants it to do, okay? So depending on what your patient's needs are, You might choose whatever you want, but the most natural one is going from extension to flexion, okay? So that is D1 flexion. D1 extension is exactly the opposite, okay? The hand opens, goes into ulnar extension, the fingers open, wrist extension, ulnar extension, and then the shoulder goes into extension, abduction, and internal rotation. Okay. Now, the extension that we're talking about, okay, does not have to be full extension. The extension that we're talking about can stop at the plane of the body. It doesn't have to go, because PNF doesn't move in extreme positions. Okay? So, here to here. Okay? And again, with extension, the elbow can start flexed and stay flexed. It can start extended and stay extended. It could be any combination. Okay? So that's D1. Okay? The diagonal, when people start, they're not going to start out here. You start, the upper extremity diagonal is a little bit wider than the shoulder. Okay? In extension, and then comes up and across, and then down and back. But it's not going out like this. And it's not going behind back. Okay? So that's D1 extension. D2 is the up and out. So do we have D2 there?
Yes.
Okay. So D2, the shoulder's going into flexion, abduction, and external rotation. Okay? The wrist is like a hitchhiker move. Okay? The wrist goes into, fingers go into extension, the wrist goes into extension. So it's here. Okay? Now, people, and I see this right now, this is not D2. This is D2. D2 is if you're gonna try and reach up, and remember that trunk elongation?
Yeah.
Okay, you want trunk elongation. So if you're doing D2, you should be weight shifting to that D2 side. Remember we did that earlier today? So if you, everybody stand up. So let's be in a position to do D2 flexion, which means that your hand is going to be on the opposite ASIS. Fingers flexed, wrist flexed. Okay. Then you're going to open your fingers, extend your wrist, and bring your thumb up behind you so you're externally rotated. Now, feel if you have shifted your weight. If your weight is centered, then you didn't do then you're in the wrong diagonal. If your weight went all the way onto your right side using your right hand, okay, and you're standing more on the right with your left leg even plantar flexed, okay, then you're in D2, and then close, turn, and come down. Do a little trunk flexion with it, and looking at your hand. Now your weight should be on your left foot, okay, and then open, turn, and come up toward the ceiling, and let your weight shift to the right. Now your thumb should be pointing back. Yeah, and then close, turn, and come down, and feel the weight shift. Okay, now on the left, and come up, and your weight should be on the right. Okay? Now switch hands, okay? Start out, left hand on the left ASIS, your weight is on the right side. Look at your hand, open your hand, turn, and come up and let your weight shift to the left foot, okay? And I don't see weight shift over there at all because your arm is too far out to the side. Yeah. Think of lengthening your trunk, okay? And then come back down. Okay. So when you come down, you want to flex your head and look down towards your left hand. Open, turn, and come up. And close, turn, and go down.
I call it the sword move. You have to pull the sword out. You won't have the sword hanging out here, guys. You want the sword all the way up. So it's but just with the hand extended. So pull the
Sword facing the ceiling. But the most important thing, because we're not going to get into sword play, is the weight shift. That's the most important thing. Because if you as a therapist, and I see this in the clinic all the time, I have people say to their patients, start here and bring your arm here. Okay? What did that do?
Nothing.
It's not PNF-y, that's PNF-y, okay? Because PNF is a full body activity, okay? And, you know, think about it, as I said earlier, you can use D2s very effectively for weight shift, whether the person is sitting, whether the person is standing, okay? And it's extremely effective because people are not thinking about shifting their weight, they're thinking about elongating, reaching up to the ceiling. Okay? Okay, so how much weight shift do you get with D1? You can still get a weight shift, okay? But it's not so much an elongation. But if I'm doing D1 and I look down at my hand, as soon as I look down at my hand, my weight is on my right foot, my right hand. Close, turn, and come up, and I'm still weight shifting, but not as much because it's limited by my trunk rotation. So I'm still weight shifting, but not as much. So, if you have somebody who has, who's afraid to weight shift a lot, you can work with them on D1, okay? If they are less apprehensive about weight shifting, you can work with them on D2, okay? So, because D1 doesn't allow you to weight shift as much. So if I'm in D2, I can easily fall over, but if I'm in D1, I'm not gonna fall over, okay? Okay, so now we get into actually trying these patterns, okay? And here's where you're gonna all feel like you don't have enough hands, okay? So let's have somebody come on up here, and we're gonna do D1. Okay, so do you wanna save this for you to do later?
They did it last class, but we had to move from that time. We came up here and we held the questions for later.
Okay, all right. So, yeah, let's start with this one.
All right, guys, you remember these pictures? You changed them. Were you able to? Can you tell what position is this? The first image? So the first one is, you would say,
that this person is in D1 extension, or you could say is in a position to do D1 flexion.
So it's the starting position for D1 flexion. It's the ending position for D1 extension.
Almost the ending position.
Almost.
Yeah. Okay.
How about the second one?
All the same stuff.
Is in a position to do G2 flexion, or is at the end of D2 extension.
So can you repeat that?
So this one is in position to do D2 extension, a D2 flexion, or it's almost at the
End of the D2 extension. So when you think of the pattern, it goes back and forth, correct? Yes or no? Yes. So it could be a starting position and the ending position for the next pattern. That's all that it is. So it is, if you look at the first one, we begin here, we finish here. But we also begin here and then finish here. So it is going from an extended into flexed position. So this is a D1 flexion pattern. We are starting with this position. So think of like Dr. Sofer said, bring the hand to the mouth, right? So we begin here, we finish here. Then if I want to do into extension, we go from here and finish here. So it is a finishing position for D1 extension, starting position for D1 flexion. Now if you think of this one, my apologies, I always like it short because that's how I've remembered for the last 10 years. So if you think of that, if the hand is across, and you're going to bring it all the way up, right? So we are going from which position to which position? This D2 what?
Flexion.
Yes, D2 flexion. So it is the starting position for D2 flexion, and it is the ending position for D2 extension.
Okay. Good. Okay. So who was my volunteer?
I don't know. Yes.
Okay, on your back. Okay. So those of you in the back should probably come up front, because you need to see the details. So we're going to start with D1 flexion. So it's flexion, adduction, external rotation. Okay. So I need to be on the upper arm, flexor, adductor, flexor, adductor surface. Okay. So if I'm gonna take her to start out here, okay, my forearm has to, one of my arms, my hands, has to be here. Flexion adductor surface, okay? So now I'm not gonna worry about her hand yet, okay? But she's going to supinate, right? And externally rotate. So what I want you to do first is rhythmic initiation. So what you're gonna do is take your hand and bring it up towards your right ear and then bring it down. So because there's a lot of moving parts, when I first start with my patient, I'm not gonna worry about the hand yet. I'm gonna add the hand in later. So you're gonna take your hand and you're gonna come up here and then go back down there, okay? So now, that was rhythmic initiation, okay? Now I'm gonna put my hands on her supinator surface, on her flexion adductor surface. And now turn your hand, bring it up, come on up, and then come back down. So I'm just going to get used to doing that. Actually, what I'm gonna do is change my hand, bring it up, and then come here, okay? So this works out better rather than having my hands crossed. So put my hand here, okay? Bend your elbow, bring it up, and as soon as her shoulder starts to move, I bring her up here, okay? Now, don't worry about the hands yet, okay? Now, to come down, okay, I'm gonna be on her pronator surface. You're gonna come here and then down here. So I have to uncross my hand, cross my hands here, bring it up, come up, cross, and pull down, push down, and here, okay? Now, what my body is doing is I'm facing this diagonal, okay? I'm facing that way, and then bend your elbow, and then I pivot and come on up. And then I'm facing that diagonal, and bring your hand, reach up to the ceiling and turn down, okay? So I'm going from here to here, okay? It's a pivot, okay? When you pivot on your feet. Don't try and lock your feet and then do this, because you're gonna hurt your back, okay? So the pivot is that, okay? Okay, so first you're gonna practice that, and then you're gonna add the hand to it. When you're coming up like this, it's radial flexion, okay? So you have to be on the flexor surface radial side. So you put 1 or 2 fingers in there. So she's here, squeeze my hand, okay, turn and come up and over, okay? And now coming down, it's ulnar extensor. So open your fingers, reach up to the ceiling and push down to the floor. Okay, now I change my proximal hand to distal. So this hand comes here, close your fingers, and now turn and come up. Okay, open your fingers, turn and go down. Okay, that's the sequence. Close. And as she bends, and as soon as her shoulder starts to move, I go on the flexor adductor surface. Then I change my proximal hand, make it distal, open your hand, turn, and come down. One more time. Proximal hand goes distal, close, turn, and come up. Open, turn, and go down. So although I am at her midsection, my headlights keep changing, okay? So just practice that, okay? Practice that till you get that sequence, and then we'll add resistance. Because that